commitment of others. And I want to recognize Lena Miner and Scotty Foltz for their work in putting together. And I want to thank everybody who's taken the time to nominate folks that they felt are deserving of this special recognition. And so the way that we've done this in the past is I've usually been on the front of the DS handing out the awards and congratulating people, but this one will be much easier for me because Louise Vasiliki, our Associate Vice President for Academic Affairs in the Health Science Center, is the master of ceremonies for that. And Louise does such an extraordinary job for all of our faculty and for our entire Health Science Center in helping facilitate and oversee our education mission in the clinical and the other schools, all the schools in our Health Science Center, and also oversees all of our faculty development, promotion and tenure, and others, and just as a great advocate and a great leader for us. So Louise, I'm going to turn it over to you, and I'm going to mute and sit back, and I'll be back to make some comments at the very end of this celebration. But thank you guys all so much.
All right. Thank you so much, Clay. And I do welcome everyone here today, and certainly want to extend my congratulations in joining in this celebration. I want to talk to you a little bit about how this is going to go on Zoom. We actually have two links because you all are recipients of the award. You got a Zoom link, so you're actually on the Zoom, but we have you not on camera. When I'm reading about you, our technician will actually put you on as the main person that we can all look at while I talk about you. And then we also sent a YouTube link to others so that they can watch this. So we actually have two streaming things going on. We're streaming this, and we also have us on the Zoom call. So just to let you know what's happening. So let's start with our first award recipient, and that is Dr. Hassan Ramadan. Now, can we put Dr. Ramadan? Can we feature him? Okay. This award recognizes faculty for sustained outstanding achievement in providing quality, patient-centered care with compassion, integrity, and honesty. Dr. Ramadan joined WVU's Department of Otolaryngology in 1990. He has been a pivotal member of this department, serving the patients from West Virginia and beyond for more than 30 years. He has made major clinical contributions locally, nationally, and internationally in the field of otolaryngology, and more specifically in the world of rhinology and pediatric otolaryngology. He consistently offers excellent care for his patients. He has carried his experience globally and served as a chairman of the Pediatric American Rhinologic Society for 6 years. In addition, he is the only otolaryngologist in the history of the department to hold a high-ranking leadership position as a vice president in the most prestigious society in otolaryngology, the Triology Society. He is considered an authority in pediatric rhinology throughout the world. Congratulations, Dr. Hassan Ramadan, for being the recipient of the Vice President's Master Clinician Award. Everybody clap now. Excellent. Thank you. Okay, our next award recipient is Dr. Troy Krupika. Dr. Troy Krupika. There he is. Okay, welcome. He is the recipient of the Vice President's Award for Outstanding Achievement in Local or Regional Service. This award recognizes faculty for outstanding achievement in advancing the service mission of the Health Science Center at the local or regional level. As Section Chief of Hospitalist Medicine, Dr. Krupika has taken the lead on expanding his section that now provides the highest volume of inpatient service in the hospital. The work of the section has improved access to Ruby, which has benefited patients across the state. Dr. Krupika's team not only ensures access for general medicine patients, but has developed collaborative services with specialty areas such as nephrology, oncology, cardiology, and trauma surgery. During the past year, he and his section have been on the forefront of our COVID response. When the pandemic started, he immediately developed our non-ICU COVID services and maintained them throughout, making staffing changes on the fly as the situation constantly fluctuated. He was also an active participant in operational planning throughout the hospital, participating in daily meetings for his department, the ICU, and the hospital-wide Incident Command Center. Another critical component of West Virginia's response to COVID was providing care for nursing home patients. Dr. Krupika immediately coordinated a response in all the facilities where his group participated in care. They segregated COVID positive and negative patients and provided much of the care for COVID positive patients in their facility. He has been instrumental in developing critical services that allow our institution to function at maximum capacity while maintaining quality care. During the crisis of 2020, he stepped up even further in supporting our patients, both institutionally and across the state. Congratulations, Dr. Treya Krupika, for being the recipient of the Vice President's Award for Outstanding Achievement in Local or Regional Service. All right, everybody, clap, clap. Excellent. All right, our next recipient is Dr. Shano Thiangaligam. Where is Dr. Shano? There he is. Okay. He is an assistant professor in the Department of Medicine, the Eastern Division. He's our recipient for this year's Vice President's Award in Outstanding Achievement in National or International Service. This award recognizes faculty for outstanding achievement in advancing the service mission of the Health Science Center at a national or international level. He has contributed significantly to the field of medicine locally, nationally, and internationally. Locally, he's spoken at high school health care club to many high school students about the journey to becoming a physician. Additionally, he has provided education on geriatrics as it relates to the COVID-19 pandemic to the West Virginia Health and Human Services Collaborative of the Eastern Panhandle, a coalition of health and social service organizations. His major impact has been in the research field of geriatrics, with numerous publications and presentations at both the national and international levels. He is truly an international physician, having medical board certification in the United States of America and Canada. He's an active member of the International Technical Advances in Science, Medicine, and Engineering. I'm going to call that TASME. He actually founded the TASME Medical Education Division and has taken the lead to organize online educational videos for an international audience. His transnational knowledge in medical practice has been recognized as an asset in TASME global educational initiatives. He's spoken on live television regarding diabetes, hypertension, and the COVID-19 pandemic in the US and Canada. One of his most notable innovative contributions to the community and hospital was the creation of the research and guideline-based electronic medical record delirium order set to implement across the entire Robert Wood Johnson Barnabas Health System. Congratulations to Dr. Shano Thiangaligam for being the recipient of the Vice President's Award for Outstanding Achievement in National or International Service. Thank you. Our next recipient is Dr. David Smith of the Vice President's Award for Outstanding Achievement in Research. This award recognizes outstanding achievements in research, scholarship, or creative activities. Dr. Smith came to WVU in 2010 after outstanding research experience as an instructor at Harvard Medical School. He's proven to be an excellent researcher and a tremendous asset to our academic and clinical faculty. He jump-started his research program in the WVU Biochemistry Department with publications in high-impact journals such as Cell, EMBO, and Nature Communications on mechanistic aspects of proteasome activation and mechanisms under normal and pathological conditions. His research program's breadth shows originality and innovation as demonstrated by his work on the mechanisms of proteasome impairment by neurodegenerative disease-associated oligomers. This work is also highly translational and very impactful in the field. He holds multiple vital patents based on his innovative research on activators of proteasomal degradation and uses thereof. The development of these compounds has enormous potential for treating neurodegenerative diseases and cancer. His pioneering work on proteasome activation has been recognized through invitations to speak at national and international conferences and meetings, study sections, and journal reviews. Dr. Smith has delivered over 40 invited lectures and podium talks across multiple academic institutions, including Rockefeller University, the University of Pennsylvania, the University of Michigan, and Baylor School of Medicine, representing West Virginia University. His strong research performance and success helped WVU to recruit exceptional new faculty and graduate students. He was selected as a headline speaker for 20S Proteasome Degradation Pathway meeting in 2022 in Tel Aviv, Israel. He served as chair and organizer for Protein Misfolding Drug Discovery Summit PROTAC Workshop 2020 in Boston, and further attesting to his unparalleled contributions to WVU's academic mission and enhancing educational opportunities. Congratulations, Dr. David Smith, for being the recipient of the Vice President's Award in Outstanding Achievement in Research.
Thank you so much. It's a real honor.
You're welcome. Our next recipient is Dr. Marina Galvez Peralta. She's an associate professor for the School of Pharmacy in the Department of Pharmaceutical Sciences. She is this year's recipient of the Vice President's Award for Outstanding Achievement in Teaching. This award recognizes faculty for outstanding achievement in advancing our teaching mission at the Health Science Center. Dr. Galvez Peralta came to the School of Pharmacy in 2015. In 2018, she assumed the role of Assistant Chair of Teaching for the Department of Pharmaceutical Science. She is consistently working to improve her teaching, as evidenced by the many teaching-focused meetings and seminars she attends. She takes the ideas that she learns from conferences and adapts them into the numerous courses she teaches. She consistently asks for student feedback so she can assess the effectiveness of her new techniques. Trained as a basic pharmaceutical scientist, it is extremely impressive how she utilizes active learning to link foundational concepts to clinical application. She also works and mentors students in the area of research. She oversees the area of emphasis in translational research. In that role, she pairs up faculty with students so that the students can gain research experience. She has not only mentored numerous students herself, she also works closely with students as they are mentored with other faculty. She consistently works to help the students present their research at a public venue, and she troubleshoots a variety of issues to ensure that students are able to complete their research. She consistently works hard to improve the curriculum for PharmD students. Her passion towards making the program better and ensuring our graduates are successful is evident in the time and commitment she puts forth in these efforts. Although she has only been at WVU since 2015, she has also taken a significant role in the mentoring of new faculty in her department. She reviews slides for faculty, conducts numerous peer evaluations of teaching, and works with faculty to ensure their content fits into the overall course and curriculum. These roles are not always evident on the CV, and it is some of these behind the scenes activities that she completes that really attest to her commitment to educating our students. Congratulations, Dr. Marina Galvez Parada, for being the recipient of the Vice President's Award in Outstanding Achievement in Teaching. All righty. She's smiling. All right. Our next recipient, Dr. Vishy Ramamurthy, is the chair of the Department of Biochemistry and a professor of biochemistry. He is the recipient of this year's Vice President's Mentor Award. This award recognizes faculty who have provided outstanding mentorship to students or to faculty colleagues within the Health Science Center. Dr. Ramamurthy has demonstrated extraordinary dedication, effectiveness, and productivity as a mentor, with tenacious efforts to mentor faculty, graduate, undergraduate, and medical students during his current tenure at WVU. He provides high-quality mentorship to students and peer faculty, demonstrates a positive impact on former mentees as documented by the strong letters of support we receive from them, and contributes to mentoring initiatives within the Health Science Center, leading the mentoring program in the biochemistry department. He is an established source of advice and support for students and faculty peers. As a chair of the biochemistry department and research director for ophthalmology and visual sciences, he was instrumental in recruitment, retention, and mentoring of many visual science faculty across the departments of biochemistry, ophthalmology and visual sciences, and neurosciences. His holistic mentorship style, commitment, and vision led to the successful launch of an academic career for many junior faculty, postdoctoral fellows, residents, and graduate students. The School of Medicine previously recognized his exceptional graduate student mentoring efforts. In 2017, he was awarded the first prestigious HSC Mentor Award based on students' nomination. The students described him as a committed, constructive mentor who guides each student. His students reported sincere appreciation of his positive feedback. The unique characteristic of his mentoring style and laboratory environment was very nurturing. They appreciated the family-like atmosphere within his laboratory. Such an atmosphere fosters creative, scientific thinking and provides a strong support network. Benefiting from his excellent mentoring and support, his graduates have won multiple local, regional, and national awards. Out of 8 recent graduates, 5 are conducting innovative research as postdoctoral fellows, and 3 entered medical school and residency programs as MD PhDs. Congratulations, Dr. Vishy Ramamurthy. You are this year's recipient of the Vice President's Mentor Award.
Thank you, everyone. It's an honor to receive this award. Thank you.
You're welcome. All right, our next recipient is Suzanne Danley. Suzanne is a research and grants analyst for the WVU School of Medicine in the orthopedics department. She has been one of the go-to individuals for the research program for 20 years. She handles a multitude of tasks with dedication and organizational skill, whether it be editing manuscripts, discussing scientific study design, maintaining budgets and schedules, or just ordering supplies. She does it with a smile and conviction that empowers others to do great research. She has been instrumental in the amazing research productivity of the orthopedic department for years. She's been crucial in supporting various joint clinical research projects in many capacities and routinely goes above and beyond, which benefits the whole institution. She listens to research ideas and molds them into a cohesive project. Her willingness to help with the initial daunting phases of research make it very easy for the work to get completed. She is always available for questions and responds quickly to any issues. Congratulations, Suzanne Danley, upon being the recipient of the Vice President's Award for Clerical Secretarial. Yay. All right. Our next recipient is David Fullader. And he is the Grants Administrator for Research and Graduate Education. David has been with the Health Science Center pre-post-award grants administrative team for many years, with over 20 years of experience in processing grants and contracts. His experience and time in this field is evident by his ability to provide the most thorough and well-organized thoughts and answers to any question. It is evident that he is extremely dedicated to his field of practice, to creating efficient working systems for tasks, and to helping others. He goes above and beyond his normal responsibilities by offering answers to any type of grant-related questions, reaching out to other departments to get answers to questions he's not even responsible for, and also for working extra hours answering emails and any type of inquiry. His positive support on the administrative side of projects brings a sense of calm to the usually intense situation. He has set high standards for cross-unit collaboration and overall effectiveness for performing one's duties and job function. Congratulations, David Fullader, for being this year's recipient of the Vice President's Award for Administrative Managerial.
I'm humbled. Thank you.
All right. Our next recipient is Christopher Braum. He is a professional technologist for Health Science Center Information Technology Services. Chris has worked for IT services for nearly 20 years. In that time, he has worked the main help desk, the School of Dentistry help desk, run his own IT company, while simultaneously raising 2 sons, volunteering as a baseball coach to their teams, teaching them his trade, and volunteering to help a number of employees and friends with their personal technical issues in his spare time. He is so respected in the industry and department that one of his sons has even followed in his footsteps and now works for IT services for the main campus. He is the embodiment of patience, determination, calm, creativity, and thoroughness. When presented with a project to manage or a problem that cannot be tackled by anyone else, Chris methodically troubleshoots and diagnoses the problem until a resolution can be found. During the COVID transition from work from home, Chris worked to get all 150 School of Dentistry employees comfortable with remote access and tirelessly configured new machines for users to take home to ensure they could work safely and be comfortable from what many used to call their kitchen, but have learned to call their home offices. Chris is regularly consulted for his expertise, his patience and thorough knowledge of both the user's needs and how the user integrates with the technology they use daily. As a result, he's able to anticipate and solve problems before the faculty and staff ever know that a problem exists. He's not just another technician. He's the reason the School of Dentistry is leading the industry in 3D scanning, modeling and printing, digital radiography, and why WVU is the second school in the country to introduce robotic dental surgery with the Yami surgical robot. Congratulations, Christopher Braum, for being this year's recipient of the Vice President's Award for Paraprofessional Technician. Good. All right, our next recipient is Dr. Brianna Shepard. She is a research associate in the Office of Health Affairs for Rural Health. She began her career at WVU over 6 years ago as a program coordinator for the Institute for Community and Rural Health. She was quiet, determined, and energetic to get things done. Her major role was to develop outreach programs for health profession students to get them interested and passionate about rural health and rural health careers. She developed and implemented Rural Health Day, which is currently in its 5th year. Undergraduate students from West Virginia and surrounding states come to the WVU Morgantown Health Science Campus for a one-day mini conference focused on applying to medical school, understanding requirements, and hearing from those practicing in rural areas in the state. In addition, students have the opportunity to participate in hands-on learning sessions, including suturing, ultrasound, acupuncture, and wilderness medicine. To date, over 270 students from 16 colleges and universities across West Virginia and the region have participated. Rural Undergraduate Shadowing in Healthcare, RUSH, was envisioned and developed under her leadership. One of the fundamental goals of the WVU Institute for Community and Rural Health is to increase a future healthcare workforce equipped to service rural and underserved communities. The success of this goal is deeply rooted in the expansion of students' interest and the need to capture that interest as early as possible. With that caveat, she envisioned an opportunity to offer undergraduate students with an interest in rural healthcare a chance to shadow a practicing rural physician or dentist. This experience, especially early on in their college career, helped to steer them in the right direction in terms of a rural concentration and ultimate rural practice after medical or dental school. Dr. Shepard has grown in her skills and abilities during her tenure at WVU. She has the knowledge to address and solve complex problems, as well as the skills to be able to convey that to others. She has the ability to teach others data collection and qualitative and quantitative research methods with easy to understand examples. She has a love and passion for telling a story with data, and that shows in both her professional work as well as the way she works with and teaches students. She's an effective communicator and evaluator who promptly offers constructive feedback. Her ability and skill to collaborate with the Rural Health Network leads to lasting impacts felt throughout the state. Congratulations, Dr. Brianna Shepard, on being this year's recipient of the Vice President's Award for Professional Non-Teaching. Yay. Okay. Our next recipient is a team award, and the West Virginia Breast and Cervical Cancer Screening Program is this year's recipient of the Vice President's Team Achievement Award. So the members are Summer Miller, Shelley Dusick, Zachary Jarrett, Anna Reno, Ruthie Watts, Elizabeth Austin, Patricia Ward, Adam Boss, Cecil Pollard, and Andrea Calkins. Welcome, all of you. The mission of the West Virginia Breast and Cervical Cancer Screening Program is to increase the number of West Virginia women screening for breast and cervical cancer in order to reduce the incidence and mortality from it. The threefold effort of this group is to equip providers to allow them for screening, diagnostic, and treatment services to West Virginia women, to implement evidence-based interventions to increase screening in low-performing clinics, and to meet West Virginia women in their community to inform them about screening resources and important screening guidelines. These efforts all work together to reduce incidence of and mortality from breast and cervical cancer in West Virginia. The team is comprised of 10 dedicated, talented, and innovative staff who come together to work across the state of West Virginia, with 8 staff based in Morgantown and 2 located off campus in Wirt and Grant counties. In a year that has been clouded by COVID-19, safety protocols, detection, and vaccination, approaches to the team's work has had to pivot to new strategies and practices that work in these times. As WVU mandated Health Science Center staff work from home and stop travel, the first challenge for the team was to figure out how their work could be done virtually. The team quickly showed its nimbleness for connecting with each other by using WebEx, team pages, and Zoom platforms to conduct weekly meetings to strategize on how to continue work in the community during a pandemic. As some team members had greater skill and familiarity with this technology, they took on the role of teaching and walking the rest of the team through setting up and using the technology. This gained knowledge by the team soon transferred to staff, teaching their clinics, work sites, and community partners how to use the same technology. They have shown great resiliency as they continue to find new ways to work and to keep the importance of breast and cervical cancer screening before providers, employers, and individuals. Congratulations, West Virginia Breast and Cervical Cancer Screening Program team, as this year's recipient of the Vice President's Team Achievement Award.
Thank you.
Thank you.
Yes, you're welcome. All right, our next team, the WVU Health Sciences Interprofessional Education Team, is this year's recipient of the Vice President's Go First Award. The members of this team are Gina Baugh, Christy Barnhart, Amy Burt, Kimron Evans, Amy Funk, Adam Hoffman, Jennifer Moman, Tony Morris, Jenna Sizemore, and Amy Summers. This team developed the Interdisciplinary Education Apartment Simulation Ideas project, enabling learners from multiple health science schools to explore and better understand the challenges that patients face after discharge to go home from the hospital. Along with the focus of the patient-centered challenges, the interprofessional team members are able to learn the nuances of the different professions and that it takes a village to care for today's patients. Each time this project faced challenges, this team was able to find a way to overcome and make the encounters more meaningful. Some of these challenges were getting learners to participate in a non-required educational activity, finding a location to simulate an apartment or house, finding a new location for safety reasons, funding to continue the program, facilitating implementation into the curriculum for sustainability. Each of these hurdles were met and overcome, and then the COVID pandemic hit. With the restriction for in-person activities, continuation of this program seemed to be in jeopardy. However, this innovative team looked to technology and virtual applications to create an even more robust ideas encounter. With the assistance of a research and scholarship grant, the team was able to purchase a telepresence robot. Permission and special training of a standardized patient enabled the robot to be placed in the standardized patient's home and utilized for the idea sessions. The robot is operated by the simulation education specialist and enables the learners to interview the SP, do a walkthrough of their home, and develop a plan of care. Not only has this allowed for an innovative, interactive educational activity to continue, but outcomes and input from the learners support the case that these changes have improved the overall encounter. The use of a robot has transformed and enhanced this educational opportunity while, during a pandemic, keeping the learners distanced and safe. The next phase of this program will be to translate the educational training into interprofessional team home visits within the state of West Virginia. Congratulations, WVU Health Science Interprofessional Education Team, as this year's recipient of the Vice President's Go First Award. Yay, I'm clapping. You can hear my clapping. Very good. Okay. Our next recipient is Dr. Treya Hagerty. Wow, we've got a fan club. She is this year's recipient of the Women in Science and Health Mid-Career Award. This award recognizes a woman faculty member, here we go. This award, sorry. Where are you? Your kids threw me off. I was so excited about it. All right, guys, let me get it back together. All right. This award recognizes a woman faculty member at the assistant or associate level who demonstrates sustained exceptional achievements in diversity and inclusion, education and mentorship, research and scholarship, leadership, and service to the state of West Virginia while supporting the WVU Health Science Center mission and WVU values. Dr. Hagerty devotes her career to serving West Virginians, and her heart is in family medicine and rural health. She's an associate professor, WVU School of Medicine Rural Track Program Co-Director, Rural Scholars Program Director, and West Virginia Area Health Education Center's Program Faculty Affiliate. Her research addresses important clinical, socio-political, and socioeconomic topics in rural and family medicine. She's a leader and champion for rural medicine, establishing training programs and activities to better West Virginians' health. She's an excellent clinical provider, evidenced by multiple top provider awards. She exemplifies that for which the Women in Health and Science Award stands. Congratulations, Dr. Treya Hagerty, in being awarded the Women in Science and Health Mid-Career Award. Okay. All right. Our next recipient is Dr. A. Courtney Devrie Nelson. She is the recipient of this year's Women in Science and Health Advanced Career Award. This award recognizes a woman faculty member at the full professor level who is recognized on a national and international level and demonstrates sustained exceptional achievements in diversity and inclusion, education and mentorship, research and scholarship, leadership, and service to the state of West Virginia while supporting the WVU Health Science mission and WVU values. Dr. Devrie is a vibrant and highly accomplished senior scientist who is a wonderful role model for both women and men, and both trainees and accomplished researchers. She is a rare individual who demonstrates both an extraordinary scientific talent and a willingness to share her secrets for success in order to elevate the faculty around her. She also has been exemplary in her training of the next generation of researchers, producing a diverse group of enthusiastic, highly skilled, and highly collaborative new investigators. For all of these reasons, Dr. Devrie is an excellent recipient of the Wish Award. Congratulations, Dr. A. Courtney Devrie Nelson, in being awarded the Women in Science and Health Advanced Career Award. Congratulations to all of our award recipients. It has been my honor to read about you, to be a part of this, and to be able to share with everyone your accomplishments, and our sincerest congratulations. I also wanted to announce that you do have, I also wanted to announce that there is an award, like a glass piece, that is going to be available in the VP suite anytime next week. So if you could stop in at the suite to pick up your award whenever you're in the building, that would be great. So we'll have that there for you. So now I'm going to hand this over to Clay.
Well, thank you, Louise, and congratulations to all of you award recipients. It is really heartwarming to hear the stories of impact that you have created for others, and we are just so grateful for your service both to the Health Science Center, the university, and the state of West Virginia, and so many people that you've influenced and helped and made the environment richer and better and more open for them to be the best version of themselves. So thank you so much. One award set that we had planned to also cover, but we will do in a separate ceremony when we can get back together in person, is the group of people that have contributed so importantly for the COVID pandemic response for the state of West Virginia. And there's a group of people who have really committed themselves selflessly, as the rest of the recipients here have done, to spend time and effort in creating real world solutions to some of the problems that we were experiencing during the pandemic, and working on the ability to create personal protective equipment at a time that we really needed that to protect our workers, that worked on diagnostic testing, whether it be PCR testing or quantitative antibody testing or next generation sequencing, among many other sort of elements of response for the state, also including a lot of data capabilities that were brought forward by people from the university. So to me, you exemplify the best of our best, and again, we're certainly grateful for that. But for the people that have contributed to the state's response to COVID-19, we wanted to have a bit of a separate ceremony that would also include some folks from our state leadership group to be able to really do a hearty congratulations and recognition of your efforts. And because of the time with the Delta variant circulating so dramatically here in West Virginia, and because everybody on the state leadership team right now is consumed with trying to navigate that, we thought that it would be better to postpone that celebration perhaps until later in the spring. But we certainly don't want to fail to recognize your great efforts and to let you know that there's more to follow. And for all the recipients here, we do have a recognition award that we absolutely want you to have and display proudly, and know how much we appreciate your efforts and know what a better place we are because of you. Louise, thank you for your hosting. And with that, I think that's the end of our program. So ordinarily we'd have refreshments, but we'll need to do that in the future too. So thank you, everybody. Congratulations. Have a really good evening and be safe. We are in a point in time in which, it's the Delta variant circulating. So take care of yourself and your families. Be well.